Army medics will be used to bolster Gauteng's COVID-19 fighting capability. It's hoped the force multipliers will help frontline workers deal with overburdened facilities. The province is currently the epicenter of the outbreak. Govan Whittles following those developments for us, joining us now from Chris Hani Baragwanath Hospital in Soweto. Govan, what's happening there?
Good morning, brother, and good afternoon. Well, the people behind me are preparing for the arrival of this deployment of the SANDF, which will, as you said, bolster the fight against COVID-19 in the province. And they'll be welcomed here at the Chris Hani Baragwanath Hospital by the Premier and the Health MEC in about an hour's time. And that's when we'll get some more clarity, Bradan, on exactly where these SANDF troops will be intervening, whether it will be in the hospitals, in the ICUs, or as a contingent of nurses to help the patients that are coming through. But at the moment, you can't see it immediately, but there is a huge number of elderly people that have come here to receive the vaccines. This is still phase 2 of the rollout, so anyone above the age of 60 or who has serious comorbidities would be eligible for it. And here at the Chris Hani Baragwanath Hospital in Soweto, it does seem like a lot of people are taking the time and the opportunity to try and get their vaccine. So this is the vaccination site that will be visited by the Premier and the MEC as they welcome those SANDF troops, but that'll be happening in about an hour's time. Bradan, and that's when we should hear from them not only what the state is of Gauteng's public hospitals and where the most dire need is for assistance, but also what exactly these troops will be doing and which hospitals they will be prioritizing. Of course, we're also expecting some information about what's happening at the Charlotte Maxeke Hospital from the Health MEC. Bradan.
Yeah, I mean, that's an anticipation in the air ahead of the arrival or the deployment of those South African military health personnel to assist in Gauteng, the epicenter currently of the virus. And you're saying in an hour's time or so we should expect them to be there, but currently that is one of the sites that we know has been rolling out vaccination. Is it busy today?
Very busy, Bradan, but people say it's not busier than normal. This is the consistent number of people that they have been receiving here, and they usually find that the peak is in the morning between 9 and 10 a.m. when a lot of people are coming to the Chris Hani Baragwanath Hospital, especially those that qualify for the vaccine to receive it. And the process doesn't take that long either, Bradan, about an hour and a half at most for people to go through the screening, get the particulars, make sure that they are registered correctly, and then get the vaccine. So this is, as you said, one of the sites where they're rolling out the vaccine, and we understand this is one of the sites where the SANDF troops that are being deployed will be stationed, so we would perhaps get a chance to see them in action just in the moments after they're introduced by the Premier. But we also understand that they are not going to be everywhere, but specifically where the Gauteng Health Department's resources are being stretched and where there is a clear need for more hospital beds and also more staff at the certain hospitals around the province. Bradan.
Yeah, those will be troops, of course, who are bearing the military health care kind of service with them. We'll look forward to finding out, and we'll bring it to you live here on eNCA. Thank you very much, Govan Whittles, this hour on the Midday View from the Chris Hani Baragwanath Hospital in Soweto.